naturopathic doctor. This is our live health Q&A, so feel free to drop any questions in the chat box and I will answer them for you. If you're new here, welcome. So this live stream, I do this every day and I get lots of amazing questions from you guys about different health concerns, different health topics. So I'm just here to answer them and help you out a little bit with whatever concerns that you might have. Really anything goes in terms of asking questions. So anything really health related, I will do my best to answer them. We've had some really great questions. Yesterday, we talked a lot about sleep, sleep apnea, different sleep tips. We talked a lot about there. Today, I have my whiteboard here. I'm gonna be talking about different superfoods. So we're gonna talk about that, but in the meantime, ask me any questions, write them in the chat box, and I will answer them for you. All right, and if you are new here, if you're not familiar with myself or the channel, welcome to Let's Talk Health. I'm Dr. Amanda, I'm a naturopathic doctor. I take a holistic approach when answering questions. You can go and check out my channel, subscribe, turn on your notifications so you get notified when I go live daily. All right, let's talk about superfoods. So the term superfoods, it's not a medical term. It's kind of just a, popular term, just what we talk about certain foods and call them as superfoods if they're really good, really healthy for you. There's different types of foods. So I'm gonna talk about a few different foods that I like, my personal favorite superfoods. Why don't you ask me about any superfoods or any foods that you might think is a superfood? Put that in the chat and then I will answer that for you. Okay, so one superfood, one of them that's my favorite is pomegranate. So pomegranate is a really good, what I would say, a superfood because it has a lot of different benefits in it. So one of them is it's got a lot of vitamins, minerals in there, so vitamin C specifically. And then it's got a lot of antioxidants. And I talk about antioxidants often on this channel. So antioxidants are basically properties in foods. They help with protecting your cells. They prevent oxidative damage to cells. So that is a really good benefit of pomegranate. It's also great for your heart health, cardiovascular health, and your gut health. So it actually helps a specific type of bacteria in your gut called Akkermansia, and that is really important in your gut microbiome. So why don't I just make some notes about that, but in the meantime, if anybody's just joining us, hi and welcome. I'm Dr. Amanda. This is Let's Talk Health, our live chat here. Drop any questions that you have in the comments and I will answer them for you. Okay, so we said pomegranate, heart health, and gut health. So I mentioned the Akkermansia. That's the good gut bacteria that it helps with, and then also antioxidants and really good there. So if you're just joining us, welcome to the Let's Talk Health live stream. We're talking about superfoods today. Pomegranate was one of the main ones I like talking about. But if you have any other questions, any health questions, just feel free to drop them in the chat. I get a lot of questions on here about things like cortisol, vitamin D, intermittent fasting. We've been talking about those over the past few days. So if you had any questions, any other questions, just feel free to ask them. And then if you're also watching right now and maybe you don't have a question, just make sure to subscribe, like this video. It does help it get noticed across the YouTube live stream. And then you can always go back and watch previous live streams. They will be saved to my channel, so go check that out. All right, what's another good superfood? Okay, I know a really good one, and that's kale. So does anybody like kale? I know not many people do like kale. It's quite dry, but one tip I would say when you're making kale, don't just have it raw, like out of the fridge. Either cook it, like saute it, that's really great with some olive oil and salt, or you can make it in a salad, but just what you want to do is put it in a bowl, put some lemon juice on it, and then slightly massage it with your hands. If you massage kale, it can help with breaking it down and it's a bit easier to digest. But let's talk a little bit about why kale is such a good superfood. So it has a lot of vitamins like vitamin K, vitamin A. Those are great for your skin, hair, eyes, and also just your overall immune system. But then it also contains a lot of fiber. Fiber is really good for our gut microbiome. It feeds our good gut bacteria. It can help with bowel movements. So fiber is awesome there. So let's write those down. So vitamins C, A, and K. So we said skin, eyes, immune, and then fiber. So we got gut health and microbiome. So that's a really good food is kale. So if anybody's just joining us, hi and welcome to the Let's Talk Health live stream. I'm Dr. Amanda. If you've never met me before, if you've never joined this video, this is our live health Q&A. So drop any questions that you have in the comments. I will answer them for you. A lot of questions I usually get are about different conditions, different supplements, many different types of questions that we get in the chat. So feel free to ask anything health related and I will answer them for you. So right now we're talking about superfoods. So these are 2 superfoods that we have. If you're just tuning in, I do go live every day. I try to go around this time, Pacific time in the afternoon, evening. So feel free to join us, but make sure you're subscribed and turn on notifications so you do get notified when I go live. I try to go around the same time, but sometimes I'll go at a different time. So just, subscribe and like and turn on those notifications so that way you do get notified.
What's a good, Venushu asks, what's a good food before bed?
What is a good food before bed? That's a great question. So generally before bed, you want to have something that's not too heavy, something that's easier to digest. So typically nothing that's like really high in fats or something that would be greasy, nothing like, French fries or beef or ground beef, something that's more lighter and easy to digest. So one thing that can be really good is yogurt with some nuts or seeds on that. So a little bit of Greek yogurt that's got some protein in there, and then you have nuts and seeds that have some healthy fats in there. So that would be good. Another good combination is apples with some peanut butter. So apples are a really good source of fiber, generally easier to digest. Like if we're thinking about things like fruits are usually good to digest. And then some peanut butter that's got some healthy fats and protein in there. So something that's going to be a combination of fats and protein and carbohydrates that won't just spike your blood sugar. So avoiding things like chocolate and cookies and cakes, and then avoiding really greasy foods that would be hard to digest. I would say those 2 would be kind of the main things that I would say would be great to have before bed. Yeah, but thank you for the question. If you have a follow-up question, feel free to ask it. And of course, if you are new here, be sure to subscribe and like the video. I really do appreciate it. It does help get this live stream noticed so more people like you can ask questions. So great question. So we had a question about what to eat before bed. So as I mentioned, some yogurt and fruit, nuts and seeds, apple and peanut butter or almond butter is a great option. Okay. What else? So superfoods, we talked about pomegranate, we talked about kale. Let's talk about another one. I talk about this a lot. I recommend this actually quite a bit. Flax seeds. Flax seeds are honestly a huge superfood. If you have high cholesterol, if you have cardiovascular disease, if you have hormonal concerns, if you have gut issues, flax seeds are honestly so good, so beneficial. If you have diabetes or insulin resistance, honestly, really good. They are basically high in omega-3s, and we know that omega-3 is great for supporting your cognitive health, your hormone health, brain health, all of that. Heart health, they are high in fiber as well. So fiber is great for lowering cholesterol. What it does is it helps to bind that excess cholesterol in your gut and can help with detoxifying it. So really good for that as well. So flax seeds, if anything, this is a really good one that you want to focus on. So while I write that down, if anybody's just joining us, hi and welcome. This is Let's Talk Health. I'm Dr. Amanda, naturopathic doctor. This is our live health Q&A where I answer any health questions that you have. So we had some questions today about foods to eat before bed. Yesterday I had a lot of questions about sleep and sleep apnea, so those were great as well. So if there's any other health topics, feel free to ask them. And then also make sure you're subscribed and you like this video too. So thank you. Okay, so what did I say about flax? So it reduces cholesterol. Regular bowel movements. And then I also said fiber as well. So that's what I would say in terms of flax seeds. You do want to have them grounded up. Actually, I'll make a little note, ground. Because that's the best way to help absorb them is if they're grounded up. If they're whole, they're most likely just going to pass through you and then they won't really have the same benefit. So make sure they're grounded up, flax seeds. Okay, take a water break.
Someone says they have a bump on their neck. Does Google says they have cancer.
So the great thing about Google is it gives us information. It's readily available. It's great because, anything today we can Google and we can get an answer for it. On the other hand, when it comes to health and health concerns, you want to just be careful because honestly, a lot of times, whatever you do Google, it sometimes will say, you're going to die or you have cancer or it's very serious. And maybe that just comes down to Google needs to just be cautious of what they tell somebody, right? So they try to cover all their bases. So it's hard for me to say exactly what's going on. If you do have a bump on your neck, if this is like a new bump or a new growth, I would recommend just going and getting it checked. So go see your primary healthcare provider, have them assess it. They'll be able to recommend or refer you to either a specialist if you needed a CT scan or an MRI. Honestly, just coming from you telling me that, it's hard to say what it could be. It could be something, yes, it could be something more serious. Could be something not as serious like a nodule. It could be a lymph node. It could be a growth of whatever kind, like a fat growth. So I would just recommend going and getting that checked out. Yeah. So, but thank you for your question. And also, if you are new here, make sure to subscribe and join our health community here. But yeah, feel free to ask any other questions. Feel free to leave a follow-up question. I do appreciate all of your questions, and I try my best to answer them as best as I can and try to help you guys out. Of course, it's not medical advice, as I mentioned up here. It's more so just to give you some educational tips, inspiration, and then you got to go and do your own work and talk to a healthcare provider and see what's going on. But yeah.
How to get rid of acne? I'm a 20-year-old boy.
Great question. So there's a few things when we're thinking about acne, a lot of things that come to mind. So let's talk a little bit about acne. It's a popular concern with a lot of people. And yeah, we can talk about acne. So, acne. So when we're talking about acne, we kind of want to figure out what is causing the acne. So there's a couple of things that can be causing acne. One would be hormones. So if you're a 20-year-old male, that could be very typical that it could be hormone related. Most likely it's due to increased testosterone. Now, it doesn't mean you have extremely high testosterone. It could just be you have a little bit more, or the way your body's responding to the testosterone. Another thing would definitely be looking at gut microbiome. So for example, if there is a bacterial overgrowth or a yeast overgrowth, that can definitely contribute to acne, because anytime we have something going on in the gut, that will impact your skin health. What goes on in the gut usually shows up in the skin. So maybe a bacteria I mentioned, or a yeast. And then the other thing I would look at would be diet related. So some culprits are usually things like sugar and dairy, unfortunately, but it can happen. So one tip I would say is looking at your skincare routine. You know, typically males don't usually use as much like skincare products as females would use. So just making sure you are just like washing your face and getting a acne friendly face wash or cleanser. It can help just washing your face. So acne friendly face wash, and then just wash like 2 times a day. And then I would say looking into some of these other things going on. So looking at your microbiome. So 2 would be to consider a probiotic. That can be helpful for supporting your microbiome. And then 3 would be avoiding inflammatory foods like sugar and dairy. So you may want to do a dairy elimination. Try to do it for at least 8 weeks. Like, you need to give yourself some time to clear things out. So looking at doing a dairy-free diet for about 8 weeks, looking at how much sugar you're having, sugar intake. Are you having things like soda, chocolate, sugary foods? So limiting those. Definitely looking at your gut health. You may need to do something like a stool test to see if there's something else going on if you have other gut health concerns, but probiotic can be beneficial. And then using some sort of face wash. Now, in terms of like hormonal related, honestly, you can't really do too much in that case. It's sometimes some people are more sensitive to changes in hormones. Usually as you get older, that will improve, but that's just one thing to keep in mind and to look into as well. But yeah, if you have any follow-up questions about the acne, just feel free to let me know. Thank you for your question. If you found the answer helpful, make sure to like this video. If you're also watching and you found this conversation helpful, make sure to give this video a like. It does help get it noticed across YouTube, so I really do appreciate it. And if you're new here, be sure to subscribe, turn on notifications, join our community. Feel free to drop in anytime and ask a question. I'm here every day around this time doing a live health Q&A. Okay.
Do people still use acne medication like Clearasil?
That's a good question. Yeah, so
was acne more widespread back then versus now?
No, I think it's still as widespread. I think there are different routes. Maybe people are trying to do other things rather than just using medication. But in terms of medication, there are different options. Sometimes there's topical, so like benzoyl peroxide and retinol would be your topical ones. Internally, antibiotics is commonly used, and that's what brings me back to like looking at your gut health, because if you're using antibiotics for your acne is a bacterial infection. Technically, it has bacteria in it, right? So that's why doing an antibiotic can sometimes help. However, then you're not really getting to the root cause of what's going on, and then you're impacting your microbiome health. So that's why I suggest like working on gut health and working on with a probiotic. Otherwise, you're just gonna ruin your gut health with taking an antibiotic. And then the most strongest, or like usually last resort, is using something like Accutane, which is a very strong medication, strong vitamin A derivative. And yes, people see benefit on it, but then you have a lot of side effects with that. Dry skin, dry lips, dry mouth, and then sometimes if you get off of it, your acne comes back. So doing something like this is going to take longer. It's we're addressing the root cause of what's going on, but it's going to be more beneficial long term, and then helping you like to prevent to get more acne flare-ups. But yeah, good question.
Which face wash would you recommend for the acne problem?
Yeah, something gentle like a CeraVe or La Roche-Posay is another good one. I'd say those two are pretty good and gentle, more specific for acne. Avoiding things that has like, a lot of perfume or fragrance and stuff in it. You don't want to irritate your skin. Just a very gentle face wash. Yeah, so CeraVe is a pretty good one and pretty relatively widespread, inexpensive, can find at the drugstore. You can also use like a moisturizer too. So the face wash washes everything, and then the moisturizer will just help with like dryness and moisturizing your face. Yeah.
What are some reasons for black below eyes?
Black, blue eyes?
Below the eyes.
Oh, okay, like under your eyes. So one thing that comes to mind, honestly, could be genetics. Like if you notice that family members have this, sometimes some people are just more likely to have darkness under their eyes. So that's unfortunately something you can't change. But another thing would be low iron. So if you have like that darkness under your eyes, looking at other symptoms, if you're fatigued, if you have a difficulty with like exercising, and you get fatigued pretty easily, or low endurance, those are signs of iron deficiency. If you pull down your lip and your like gums and your inside of your lip look a little pale rather than like your typical color that would match for your skin type, if you're noticing that, then those are signs of iron deficiency. But yes, so the dark under eyes can be that. So in that case, I would say go get your iron checked, get your iron, your red blood cells, your hemoglobin checked, and see if your iron levels are low. Yeah, but great question. If there's anything else that comes to mind, I will let you know. In the meantime, if there's anybody that's just joining us, welcome to our Let's Talk Health live stream. I'm Dr. Amanda, a naturopathic doctor. Be sure to subscribe, turn on your notifications, like the video. Even if I haven't answered your question, but you found it helpful just to listen, make sure to like it. I do appreciate it so much, and I appreciate all your questions, you guys. So just keep them coming, and I will answer them for you.
Milia solution, how to remove it?
So milia, these like really little tiny bumps, can sometimes be around your eyes, on your skin. Those can be very difficult to remove naturally. Sometimes you might have to go get like a facial or something done to have them removed. I would say just more so looking at your skincare routine, face wash, exfoliation, so something that's a mild, gentle exfoliator, using something like that, and then moisturizer. You may also notice it can happen more if your skin is more oily. Some people just have naturally more oilier skin. So if your skin and hair is more oily, just keeping that in mind, you might need to do, again, making sure you're washing like twice a day your face. So, great question.
Reason for black lip?
Black lips. So that could be potentially like poor circulation. So if you're not getting enough blood flow, and then your lips are like a darker color than what would be your natural, potentially you're not getting enough circulation to your body. Paying attention to like your hands and your feet as well. Are they turning more like bluer, or just not, or more pale? Are they not getting enough circulation as well? Now, the other thing I would say to look into is cardiovascular health. So in also like with the poor circulation, is there an issue going on cardiovascularly? So talk with your primary care about that. Maybe you need a referral to a cardiologist to see what's going on. Again, it could be iron related, could even be gastrointestinal related if there's an issue going on with like a bacteria, a parasite, or something going on there. But yeah, I would say that one you'd want to go just get that checked out and see what's going on.
Best fruits or veggies for cold season to improve immune system?
Oh, I like that question. So when we're looking at like in the cold seasons, we want to choose things that are more seasonal, as opposed to something in the summer. So like in the summer, we're thinking things like watermelons and what else is popular in the summer? Things like berries. When we get into the cold seasons, we're thinking more like apples and pears, citrus. So those are some really good ones. The other thing would be like when we're thinking about immune support in the cold, if your body's already cold in the cold, you want to have foods that are warm. So that's kind of like why we gravitate to having things like soups and stews in the winter time. In the summers, we like more so things like salads and like cold drinks. So a tip for that would be even like cooking your fruit, like having like cooked apples or cooked pears can be really beneficial, especially in the morning. So, having a bowl of oatmeal with cooked fruit on it, or having like making your own cooked apple or cooked jam, something like that. So that's what I would suggest, but that's a great question. Okay, so if anybody's just joining us, hi and welcome to the Let's Talk Health live stream. I'm Dr. Amanda. We were talking about acne on here. So if that applies to you, I'll leave this up here, but make sure you are subscribed, turn on those notifications so you get notified when I do go live, and then make sure to like the video. I do appreciate that, and it really does help get our video noticed across all of YouTube.
How to influence my wife to eat better in front of our kids?
Oh.
I'm really worried they will take after her. She just ignores me whenever I bring it up. Any advice on how to break through?
Yeah, that's such a good question, and thank you for, bringing that up. Sometimes it's hard to talk about these topics, but one, that's great that you're concerned about your kids' health and your wife's health as well. So this really does come down to having communication with her. So I would say, when you bring up this conversation, have it in private, like the two of you, avoid having it in front of the kids, and just letting her know where you're coming from and why you're doing this. Try to be a bit more calming in the way you approach it. Just gently let her know. If you're generally concerned and you care about her and her health, she'll see that, and hopefully that will help like open up to her trying to be a bit more, eating more healthy. Asking her, maybe seeing her point of view too. Why does she not want to change her habits? Is there something going on? Is she stress eating? Why does she not choose healthier foods? And seeing, like, just coming from her point of view and seeing things there. The other thing is like, maybe you can prepare the meal, and like you can prepare a healthier meal and see if that's something like she would then be open to eating, like having a family meal where you guys are all eating the same thing. Or let me know a little bit more about like what the habits are like. Is it more so snacks and stuff that she's having, and like and could that potentially be something going on there? But let me know a little bit about that. Honestly, sometimes it's hard to change our partners or our other people's eating habits. If maybe she's stressed out and then she's choosing unhealthier choices, maybe there is something more underlying going on. Just like, is there a blood sugar issue where she's craving sweets and things like that? Or is she binge eating? So I would just say, like, number one, communication, talking it through with her, letting her know where you're coming from and your concerns. trying to like prepare a healthy meal so you can all, what's going on? You can all have it together. And then like also just seeing like where her point of view is at. But yeah, let me know if you have any follow-up questions about that. Like that's such a tricky topic, but I can see where you're coming from.
Is it good to have coffee or tea or milk?
Coffee, tea, or milk?
Yeah.
So those are all very different drinks. So what I would say in terms of coffee, so one thing with coffee is we want to be careful with caffeine intake and how much coffee you're having. The other thing with coffee is it can be quite acidic. So for some people that can be irritating to their gastrointestinal tract. And then caffeine can cause sometimes like, what's it called? Like jitters or nervousness, or increase your nervous system too much, where it puts you in that like sympathetic fight or flight response. So in that case, it's just something to be cautious and to be mindful of how sensitive you are to it. In terms of tea can be very beneficial, especially if we're looking at like herbal teas, like for example, chamomile, dandelion root, ginger. All of the herbal teas are really good, have amazing properties to help with your health. They're all good for different things. So I do really like tea. If we're looking at things like a black tea or a green tea, just remember those do have some caffeine in them. And then in terms of milk, I wouldn't say it's like really an alternative to coffee or tea because it's kind of its own different category, but you will get some things like calcium and some good vitamins and minerals in something like milk. So I'd say all of them are okay, but all of them come with their own different benefits, or in the case of like caffeine can cause some issues there. Okay, so if anybody's just joining us, hi and welcome to the Let's Talk Health live stream. I'm Dr. Amanda. I'm a naturopathic doctor here to answer any health questions that you might have. So just drop them in our Health Q&A box. Of course, be sure to subscribe, turn on notifications, like the video. I do appreciate it. Thank you all for hanging out with me and asking questions.
Reasons for dark knuckles pigmentation.
I wouldn't say that's anything that I could think of off the top of my head for like pigmentation. Some people's skin, they just have higher pigmentation than others. Again, coming back to kind of like circulation issues, I would say looking into that. What else? Cholesterol levels, looking into that as well. That's usually more pigmentation on the skin in the form of things like skin tags that are different colors. If you're noticing different spots of pigmentation throughout your body, then that could even be potentially a yeast overgrowth in certain spots. I wouldn't say more so on your knuckles, but maybe even it's something like psoriasis or something else going on as well. So many different things that could potentially cause that, but it also could just be something completely normal with no cause at all. It could just be the way your skin has more melanin and more pigmentation. But yeah. Great question.
I'm always tired day and night, even with enough sleep. Why would this be? I've had a sleep apnea test and all is fine. I also snore a lot and jump in my sleep, and my partner has to sleep in separate beds. It's bad.
Yeah, so did your sleep apnea test come back as negative? Because that does potentially sound like sleep apnea going on. But let's talk about some things that can just generally cause fatigue. But if you are snoring, you're probably not getting enough oxygen to your cells, and then you're tired. But let's talk about fatigue. So if anybody is just joining us right now, welcome to the Let's Talk Health live stream. I'm Dr. Amanda. I answer your questions that you guys put in the chat box, so feel free to ask me any questions. Make sure to subscribe and like. And right now we're going to talk about fatigue. So one thing, yes, could be sleep issues, sleep apnea. So get that checked out. You may need to use a CPAP machine to help. That will help you get enough oxygen. So making sure that you're getting enough oxygen. Potentially the other thing that could be going on is a thyroid concern. So that can either be an overactive or an underactive thyroid. So if either of those can actually contribute to fatigue. So if you're finding you're just feeling really depleted, exhausted, maybe you're also having hair issues, brain fog, digestive concerns, anxiety, palpitations, or depression, like depending on which way your thyroid hormone is on the spectrum, that can impact fatigue. So that would be an easy check. Just get some blood work done. So go get blood work for that one. Another one would be a vitamin D deficiency. So looking at your vitamin D levels, again, getting blood work done. Vitamin D can definitely cause issues with fatigue, can cause issues with sleep if your levels are low. Depending on where you live, most people generally have lower levels of vitamin D. So seeing what your levels are, and then you can do an easy fix with that. Supplement with vitamin D, supplement with magnesium as well to help out with that. The other thing could be an iron deficiency. So looking at what are your iron levels like. Again, if iron levels are low, you're going to feel tired, fatigued throughout the day, can have issues with sleeping. The other thing I would look at would be blood sugar. A lot of times we don't realize that like blood sugar issues can cause issues with sleep as well, or can cause fatigue issues. You could be having sugar or just even eating and then having a drop in your blood sugar, or having a spike in your blood sugar, and that can cause issues with fatigue as well. I would say the main one though, because you mentioned your snoring and you mentioned waking up throughout the night, there's probably some sort of sleep apnea concern going on, maybe even sinus related, and then potentially one of these other things playing a role in there. So that was a great question. If you guys have any follow-up questions about fatigue, any of these things, let me know, and I will answer them for you. Thank you for the question. I do appreciate it. If you've just joined us, welcome, and hi, I'm Dr. Amanda, naturopathic doctor. This is Let's Talk Health. We talk all about health here, Health Q&A. Be sure to turn on your notifications and subscribe so you do get notified when I go live. I go live every day around this time, but just make sure you're subscribed so that way you know when I go live.
Google says pizza is healthy. What do you think, doctor?
Google says pizza is healthy. That's such a good question. I don't like always labeling foods like healthy or unhealthy, because there's so much variation with that, and then it creates like a stigma of like we can't eat these foods, and then sometimes when we're told something's unhealthy, then we want it anyway. So in that sense, I would say like pizza's not a balanced meal, because pretty much you're getting, it's majority carbohydrate heavy, like with the bread, and then some cheese, maybe you're getting vegetables if you're putting a few vegetables on it, and maybe you're getting some protein if you put meat on it. So in that case, if you want pizza, if you want to enjoy pizza, that's totally fine, but just making sure you're having something else on the side with it. So if you're having pizza, limit your slices to a couple of slices, and then have some protein on the side. Have some grilled chicken breast and a salad, and there you go, you have a full balanced meal. So I wouldn't say it's like unhealthy or healthy, I would just say it's not a complete balanced meal. Now with that being said, like, are you eating pizza every day? Then that wouldn't be good. Are you having it once a while, a couple times a month? Then that's fine as well. Maybe you don't need to worry about having it super balanced out, but I think everything comes in moderation, and we just need to be mindful more about balancing out meals. But yeah, thanks for your question.
Can dry dandruff cause acne?
Dry dandruff, like on your scalp, cause scalp acne?
How to remove dry dandruff?
Yeah, so with dandruff causing acne, I'm not 100% sure with the connection there. Usually dandruff would be more so causing like eczema, dry skin, but sometimes dandruff can even be due to a bacterial imbalance. So in terms of that, using shampoos that don't have any fragrance in them, kind of like more of a natural shampoo, so with no fragrance and no added chemicals or fewer chemicals. Of course, it's hard to like completely avoid chemicals, so that way it's not irritating your scalp. You do still want to make sure you're washing your hair, so don't go, like, I would say don't go more than like 2-3 days without washing your hair, because then the dandruff could build up, get itchier, and then you're scratching, and then you're creating like that cycle. In terms of working on things internally, omega-3s are really good. So fish oil, omega-3 is really good for hydrating your skin from the inside out, really important. And then probiotics as well, because when we're looking at skin health, as I mentioned before, if you weren't watching that time, skin health is super important for your, gut health is super important for your skin health. So probiotic, omega-3, some sort of gentle hair wash, making sure you're washing your hair. Those would be my top tips for that. But thank you. So if anybody's just joined us, welcome to the Let's Talk Health live stream. I'm Dr. Amanda, a naturopathic doctor, here to answer your health questions. We talked about fatigue, we've talked about acne. What else have we talked about? Superfoods. So just be sure to like, subscribe, turn on notifications. Come back tomorrow. I'm here every night to answer questions. All right. And then I just reminded myself, the person that asked about dandruff, because I drank water, keeping hydrated is so important for the person that asked about acne, dandruff, any sort of skin issue. Making sure you are hydrated. Water is so important for hydrating our skin. Maybe you want to put some electrolytes in your water too to help your body absorb it. That would be really good as well. Okay, so we will hang out for a little bit longer. So if there's any other questions, just let me know. But if not, don't worry. I will be back tomorrow. I'll make sure to answer your question tomorrow. Just be sure to jump on again. If not tomorrow, then the next day, because I'll be here.
How to remove blackness on knee and elbow?
So for that, I would say that's probably just more due to like dry skin. So moisturizing. And then honestly, it could just be due to the pigmentation of your skin. Sometimes it could be genetics as well. So exfoliating, so in the shower or in the bath, whatever you do, grab a loofah or even like a scrubber, something to exfoliate your skin. So scrubbing on, don't scrub too hard that you're injuring your skin and making it bleed. Just like a gentle exfoliation, and then moisturizing after. So things like what's it called? Like a body cream that has, Aveeno is a really good one because they have oats in there, which are nice and hydrating. You could even do an oil like a jojoba oil or a body butter with cocoa butter, that's what I was gonna say. A combination of exfoliation and using something to moisturize your skin. And then hydration too, so it's making sure your body's hydrated, so drinking water, staying hydrated. That would be my top tips for that one. Okay, any other questions that we have tonight? Okay, so we will wrap things up then. So thanks everybody for joining tonight. This is Let's Talk Health. I'm Dr. Amanda. Thank you for joining. I will see you all tomorrow. So be sure to subscribe, turn on your notifications, and like the video. And thanks everybody for watching. Have a great night.